All right, I guess we could start now.
Yes.
So, good evening, everyone. I hope you're having an amazing Sunday today. I'm with my friend, Dr. Ravinder, who is a dentist. So, just to give you a backdrop about him, so he pursued his BDS from Bangalore, and he is practicing his dental surgery, everything in Bangalore as well. He has done internships, he has experience working with professionals as well. So, today we are going to talk about oral health, about how the COVID situation is affecting the whole dental industry, especially. And a lot of you all might be very worried if you have a dental problem to go to a dentist because of the spread of the COVID. So we will be answering all of your questions and giving some clarifications on what measures to take when you visit a dentist, or just to have a hygiene, oral hygiene as well. Okay, so let me introduce to you my lovely friend Dr. Ravinder.
Namaste. Only namastes this time. No meet and greets. No handshakes. Just namastes. And I'm Dr. Ravinder. I pursued BDS in Bangalore, SGR Dental College. So basically, I'm interested in science.
Mm-hmm.
So when I'm in school stage, like 5th, 6th class, very much interested in exploring things and making very good of science and making good thoughts about it. And
So, like, where did you spark that interest to study
Yeah.
BDS? That's the main question.
It's not like a BDS. I want us to be a healthcare professional.
Okay, so you want to get into healthcare
Yeah.
industry. Okay.
Yeah, I wanted. I'm interested in healthcare professional.
Mm-hmm.
So my goal is to serve the humanity, people,
Nice.
and to make awareness
Mm-hmm.
awareness programs or any uh, kind of stuff.
Yeah. So adding to we all dreamed to help the needy, to be of some help to somebody, and healthcare industry is one of the big industry where you get to help a lot of people. We always dream of helping people, and the doctors are the one who make it
Yes,
possible,
yes,
who
yes,
make
yes,
it
yes.
happen literally.
Right.
And
Yes. Right
yeah.
now, the healthcare industry is in very top position.
Yeah, very
And
crucial
in
position
very
as
crucial
well.
position and a very important position.
Yes.
So please support the healthcare workers.
Mhm.
Please support the frontline workers, and
Yeah.
please support them. And don't demotivate or comments on them, so that they won't be demotivated.
Yeah.
As our Indian infrastructure is based on healthcare now, as of
Yeah.
now, so it is very crucial to support them.
So, what advice would you give to the young people, who are watching this right now, who wanted to pursue their career in BDS, in dental, or in healthcare industry especially?
So you can just go on,
Mhm.
however it is your aim. Just move on, and don't be shy. Nothing's gonna give you with if you are shy with whatever thoughts you have in your mind. Open up,
Mm-hmm.
speak well, and do such kind of courses which you want to do. There is no one has to stop to you. No one has to stop you.
Yeah. So one more thing, uh, on your opinion, based on your experience, is it really hard for a person to pursue BDS? Like,
Yeah, kind of. What I say is tactical.
okay,
So if you have interest, you can do it in snap of a second.
okay.
Or you have interest in medicine, you
So
can do it.
it's all about that passion.
Yes.
You
The
you
passion
need to have the
matters.
passion.
Passion matters the most
Mm-hmm.
when you do dental and medical.
Yeah. So
Without
it's
passion, you can't survive
yeah.
or
So
do anything.
there's a saying where when you love your craft, or love what you do, you don't feel like you're doing a job or you're working for someone.
Yes,
So it's like that.
Yes. You should have a passion first.
Mm-hmm.
Then only you will be surviving in any of the field, in the medical field. Without passion, you can't survive in this situation
Yeah.
or in this field.
And so in your particular field, you need to be updated every year with the latest
Yes.
technology, latest treatments as well.
Yes.
So it's not like they have studied and they're done with it. So it's a continuous process where they need to evolve to the current practices, current trends, or current equipment in their medical industry especially. And
Yes.
it's a challenging task for them to keep updating themselves and stay updated as well. So what are your thoughts on it?
Yeah, my thoughts is when what my experience is to update your knowledge
Mhm.
every 1 year by
Uh-huh.
going through conferences
Okay.
or attending any surgeries which you have
Workshops.
not seen in your life,
Mm-hmm.
or practicing from your fellow mates who colleagues and your seniors as well. So your thoughts and your mind will be getting updated, and you'll get motivated in the industry
Yeah.
as well.
So, what are your opinions about the workshops which a lot of pharmacy companies conduct, where they give new equipment or new medicines for treatment of this healthcare industry?
Yes,
So, how is it
pharmacy.
important for people in your field to attend such workshops?
Yes, it kind of important,
Mm-hmm.
but pharmacy industry is like they have a medicine and we have to recommend it.
Yeah.
So the medicine is the same, and the brand is on brand.
Different.
The brand is matters.
Yeah.
So we recommend a medicine, not a
Mhm.
brand. That's what
Yeah.
we see.
So let's talk about the dental treatment which is going on currently.
Yes.
I know a lot of people might be having a cavity or unhealthy oral. So what are your thoughts on it? Like, do the food habits really matter, or
Yes.
a regime, just to brush your teeth on time, take care of it? So your thoughts about it?
Yes, oral hygiene is very important as of now,
Mm-hmm.
because when you start your day with your brushing your teeth, right?
Yep.
So brushing your teeth, taking the toothbrush, and some people will normally do however they want, however they brush.
Okay.
So there is some techniques for the brushing, so you can look into online, known as a BAS technique, BAS technique.
Okay.
BAS technique you can see in the YouTube or anywhere else.
And one more thing to add to it. So I guess I've read it somewhere where you need to brush your teeth for only 2 minutes, not more than that.
Yes,
Is it true?
true. It is true.
Why so?
2 to 3 minutes or 5 minutes maximum should be brushing your teeth.
Okay.
Because bristles are very abrasive on your teeth.
Mm-hmm.
It will braid your enamel or
Okay.
erode your enamel,
Mm-hmm.
so that the tooth structure will reduce eventually. So it is recommended to brush only 3 to 4 minutes or maximum 5
Yeah.
minutes.
And there's also a saying where you need to change your toothbrush for every 3 months.
Yes.
You can't keep using the same toothbrush
Yes,
for
because-
6 months or more than that.
Yes, eventually toothbrush also has its life.
Yeah.
So you have to change it every now and then.
Yeah.
2 to 3 months maximum. Use soft bristle
Mm-hmm.
toothbrush, and never brush in a manner that vigorously, so that your enamel and your tooth is getting abraded.
Mm-hmm. So, apart from taking regular oral hygiene tricks, everything. So, what are your thoughts and about the current situation which is going on here?
Yes, current situation, the Dental Council of India
Mm-hmm.
gave us a guidelines, so we can only work with the emergencies. I mean dental emergencies,
Okay.
which we can say pain
Mm-hmm.
or any dental impaction. Impaction in the sense the third molar extraction.
Okay.
So which in case if it is infected, so we have to remove it. And we don't have any choice for that.
Mm-hmm.
So the pain will be very crucial. So that is considered as a dental emergency. So we
Okay.
have to remove that. So dentistry is full of aerosols.
Yep.
So related, my viewers, they know how the dentist is. Dentist is full of aerosols.
Okay.
Aerosols is nothing but a tiny particles. I mean water particles, which is less than 2 to 3 microns. So it carries the infection and infects the dental personnel or patient itself. So it is a very high risk for the dentist right now
Mm-hmm.
to take a part in only conducting medical emergency dental procedures.
That's like very important for
Yes.
them. So it's like they are risking themselves as well in order to treat others as well.
Yes, we should wear PPE while
Yeah.
doing. It is very compulsory right now because of the COVID situation. It is very crucial to wear PPE, N95 mask, surgical mask, everything.
So let's talk about the oral cavities. A lot of people eat. Maybe a lot of people may having a
Yes.
sweet tooth, especially,
Yes,
and they consume a lot of sweets in which the cavities start forming.
Yes.
So it's better to treat the cavities at the root of it
Yes.
than just to ignore it and let it go big and the whole teeth gets damaged. So what are thoughts
yes,
on it?
yes, this is where the what do you say dental awareness programs comes.
Mm-hmm.
So starting of the destruction of the teeth, we can control it. So that
Oh yeah.
so we have three layers in the teeth. One is enamel, dentin, and pulp chamber.
Yeah.
So enamel is the topmost layer, which you don't feel anything when you put
Mm-hmm.
hot, or you can. So dentin has nerves. So these are the dentinal tubules. So and pulp has a nerves. So when enamel is braided, so and dentin is exposed, you feel sensitivity.
Mm-hmm.
So
I guess a lot of
every
people might be
yes.
facing with that sensitivity
So
where
that
they drink something hot or
yeah.
cold, they feel that sensation going through their head.
So that sensitivity will be feeling, and the caries started from the enamel. It
Mhm.
reaches dentin and eventually goes to the pulp, and ultimately you will be leading with cavity or
Mhm.
pain.
Yeah.
So how can we treat this and how can we identify this? Firstly, firstly on the teeth, you will see the blackish discoloration on the teeth.
Yeah.
So many people will ignore this. Please don't ignore this. At the initial treatment stage, you will give just 5 to 600 to take out the cavity and fill the cement.
Mm-hmm.
And later on, if you ignore, if it reaches the pulp chamber, then the tooth will go to RCT. So if you delay, your expenditure also increases. So that's how the dental awareness is created among the people.
Yeah, so it's better to cut it when it's really
Yes.
at the root of
Yes.
it.
Yes.
So cavity. So let's talk about the relationship between your oral health and your heart health.
Yes.
So that's very important. Whenever you visit a dentist, you can see all this words written that how
Yes.
oral health is related to your heart health as well. So let's talk about
Yes.
it.
Yes, oral health is a very important to a person.
Mm-hmm.
Person who maintains oral hygiene will be healthy will be healthy
Mm-hmm.
ever after in his life.
Okay.
Because if a person is having oral condition like periodontitis, we call it as some disease
Mm-hmm.
to the gums,
Mm-hmm.
which it happens. So the infection might go into the bloodstream
Okay.
and ultimately goes into the heart. So
Okay.
it leads to carotid stenosis, and
So,
so
so what it's trying to say is basically when you have a cavity or some infection, it reaches your bloodstream,
yes,
and from your bloodstream it goes
it
directly to
ultimately
your
goes to
heart, and it might cause a blockage there or cause any other heart diseases which can eventually lead to a heart attack. So it is really important to have a nice oral health and a oral hygiene as well.
Okay, I wanted to add one more point.
Sure, sure.
So whenever if your father or any kind of relatives undergoing a heart surgery,
Okay.
there should be an opinion from the dentist as well. So this is the cause.
That's an interesting point actually.
From where the root cause of this heart disease came.
Okay.
So there will be an opinion with the dentist,
Mhm.
and then only the surgery is done.
Oh, this information really I didn't know that. So what Dr. Ravinder is trying to say here is like it is really crucial for everyone to have a nice oral health because ultimately if your oral health is not well, it might lead to other complications as well. The major complications would be a heart complication or heart diseases as well. So please make sure you and your loved ones have a really good oral hygiene as well and help which will help you to stay healthy overall.
Yes.
So let's talk about the situation which is happening right now. A lot of people are really scared to go to a dentist even though they're having a lot of cavities, a lot of pain which they go through. Usually they try to suppress it with some painkillers or anything.
Yes,
But
yes.
what are your thoughts on it? Like, should they approach a dentist right now in this situation, or medicines will do it?
No, as of now, meeting a dentist is not recommended.
Okay.
But if you have a dental emergency, you can call a doctor.
Okay.
So he will give the temporary remedy.
Mhm.
Whenever he is free, or whenever he is out of, appointments, he will call you.
Okay.
So at that time, it is recommended to go to dentist.
Mhm.
So make a prior appointment to a dentist and then go. Don't go as of like
Directly
outpatient,
without informing,
and
yeah.
you will be having many more appointments at that time. You have to wait. So exposure to the patient and aerosols is more. So It is
Yeah.
recommended to call and to take an appointment and
Yeah.
go.
So, can you give us a quick remedy for any tooth pain? I've seen people using claw just to put it
Yes,
in the
it is a
teeth.
temporary. It is not a permanent solution. We can't treat a teeth
Mm-hmm.
which is having a cavity with a medicine. The solution is to dig up the cavity and
Mm-hmm.
fill the cement. There are
Mm-hmm.
very types of cements. Some
Mm-hmm.
GIC, composite. These are very types of cements.
Mm-hmm.
So we can put the following follow-ups.
So, we are related to the business and lifestyle here. So, why don't you give your inputs on starting a clinic, mostly a dental clinic, running it and maintaining it and sustaining it in this time, and how do you think the industry will affect after the situation will settle down?
Yes, yes. The most affected people on this situation is dentists as of
Mm-hmm.
a lockdown.
Mm-hmm.
So they don't have any income in last 2 to 3 months
Yeah.
because of the guidelines. We have to close the clinic. No treatments have been done.
Yeah.
So this situation has come to the dentist, and many people are opting to other fields
Mm-hmm.
other than dentistry because of the situation. They are scared. Please don't be scared. Everything comes. We have to cope up with the situation, and
We just have to face
you
it.
have to face it
There's
and
no
never
running
back
away
down.
from it.
And the clinic you have to set up. It costs around 5 to 7 or 8 lakhs depending on your budget.
Mm-hmm.
So minimum is 5 to 6 lakhs according to me. So you can plan anywhere which is crowded mostly, and in villages it is recommended on your wish, on your interest. City and town is the best place, and crowded area is the best place to keep the clinics.
Yeah, so we have a question from Lipika.
Yes.
She's asking, would you recommend a teeth correction surgery over regular braces for 20-year-old?
Yes.
So would you recommend a teeth correction directly
No,
or
no, no.
to put on braces?
First, there should be an appointment to an orthodontist.
Okay,
There are certain stages of the teeth which it can be corrected.
okay.
So accordingly, an orthodontist will see the teeth and check up which is which is coming correctly or not.
Mm-hmm.
So the braces are, if we recommend only, we should keep. So we can't say that we can keep, or we can say it should be done.
So I guess a lot of people might be having this question where what is the age limit where you can put braces on? Certain age, after getting crossing a certain age, you can't really go for braces to correct your teeth or the shape of it. So your thoughts?
My thoughts are you can go after 25 or 20.
Mm-hmm.
Minimum is 21 or 22.
Okay.
So before, even with the child also they will keep. Even in the periodontics we call them. Periodontics also has what is called braces for them. So we can give from the childhood only, no problem. Which teeth are erupted after 12 to 15 maximum.
Okay. So one more thing here, a lot of people are very shy, or just to give a really good smile, or smile at certain occasions because their teeth is not correctly or perfectly aligned, or there are a lot of coloring issues. The teeth might be yellow. So what are your thoughts on it?
My thoughts is teeth is not naturally white.
Yep.
It is yellowish white. So don't scare to open up your smile with little bit of yellow. If you want a treatment to be done, there is something called bleaching,
Mm-hmm.
which I don't recommend it because it gives you sensitivity, lot of sensitivity.
Mm-hmm.
So I recommend to go to a dentist, and he will just do scaling. Scaling is a process which dentist will clean the teeth with ultrasonic scaler.
Okay.
So I recommend you go to the dentist and just clean the teeth occasionally, and the 6 months of gap. So every 6 months you should be cleaning your teeth.
Mm-hmm.
So it will be fine.
So, what do you think? Like how many times you visit a dentist in a year for a regular checkup? Like how many days there should be a gap to just to go and visit for a regular checkup? As many of you all or many of your friends would be going to have a normal regular health checkup. It is really important to, as well as to go on a regular dental checkup. So let's talk about it.
Yes, dental checkup should be done every 1 month.
1 month.
Yes,
Mhm.
1 month you can go for dental checkup. Dentist will explain you what treatment should be done if you're having any cavity or any deposits on your teeth. So you
Mhm.
should be getting cleaned, or you should be getting a filling, or you have any missing teeth. they will give you an option called bridge or an implant, so that with that we can cope up with the dental treatment. And there are many insurance companies which gives uh, insurance for the
Insurance, okay.
dental checkup.
Okay, so let's talk about the interesting topic where, let's talk about cosmetic surgery,
Yes.
plastic surgery, where people are changing their features in order to, look good, or, in order to just to resemble someone. So what are your thoughts on it? Changing your features, injecting your face with Botox, or, changing or enlarging your nose or shortening your nose, everything as such. Your opinions?
It is plastic, it is not natural. We don't know when it will go off.
Yeah.
So eventually that also has an expiry or age time limit.
Mm-hmm.
So after that we have to go again and rejuvenate that.
So it's kind of like a process
Yes,
where you get
yes,
it
it's
done
a
once.
plan.
You can't leave it just there. You need
just
to
can't leave
correct it, or you
have
need to
correct
maintain
in
it, I guess.
future. Yes.
Yeah. So it's I guess a lot of people are into cosmetic surgery nowadays, because of all the social media hype which is going on everywhere, just to look perfect on the screen, going and getting cosmetic surgery. I guess a lot of film industry actors are preferring, just to
Yes, yes.
correct their faces. So for all the normal people who wants to get it done, I guess he highly doesn't recommend it,
Doesn't
because
recommend.
it's a long term process where you need to
And
keep
it's
on
very,
doing it.
very, very expensive processes. It can
Yeah.
go to up to lakhs.
That's crazy. And after putting so much of money into it, you still have to spend
You
even
still
more
have to
just
put
to
even
maintain
more.
it.
Yes, you have to maintain it regular basis.
Yeah.
Yes. And the cinema people will have something called veneers.
Okay.
So the anterior teeth will be replaced,
Mhm.
now up and down,
Okay.
with a white teeth. So if they smile on the camera, so it will give
Oh.
a spark.
So
it
that's
it
that's
is
the
removable.
secret of the film
Yes, yes.
stars.
It is a removable thing which they wear up. Just that is called veneers.
Okay, veneers.
Yes.
So you can Google it up and search why all the actors have a really good smile and a white teeth, especially.
Sparkling.
So let's talk about the advertising industry, where all the toothpaste brands are projecting themselves, to have a white teeth when natural teeth are little yellowish in color.
Yes.
So is it a wrong display of their advertisement, or just a advertising or marketing campaign which they're
That
doing?
is 100% marketing.
Just a marketing
Just a
campaign.
marketing. Any toothpaste you can use.
Okay.
You can note this point. Any toothpaste you can use.
There's no more specific
There's no
kind.
specific kind of toothpaste. If you have sensitivity,
Mhm.
there is an upturnant effect on the tooth, which is given by Sensodyne and Sensodent. It's
Yeah.
two toothpaste which gives an upturnant effect. Upturnant effect is nothing but a soothing effect on the tooth,
Mhm.
which will minimize your sensitivity.
Yeah. So I guess after crossing 25 or 30, everybody has the sensitivity issue.
Sensitivity.
You know.
So drink less of sodas.
Okay.
So
Yeah.
which will abrase.
Good one. So let's talk about drinking a lot of sodas. So like what a routine drinking or
Yes.
regular drinking will affect your teeth, and how the way it looks as well. So I'm gonna ask an interesting question. I guess a lot of people may be having. Does having or consuming alcohol affect your teeth or your oral health, especially?
Yes.
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 So
It affects on your blood circulation of the gingiva, especially alcohol.
okay.
Alcohol will reduce the blood flow to the gingiva
Okay.
and eventually leads to what we say dental problems.
Okay, so what about the people who have that gutka or that pan masala who keep on chewing it all the time? So what
a
are your
very-
thoughts?
Yes, that's a very, very bad habit, and it ultimately leads to oral cancer.
Oral cancer.
Oral
That's
cancer, and it is not recommended by the government, and still they sell it as a marketing. And
so oral cancer. Even though like we see a lot of when you go to a theater, especially we see an ad where throat cancer, everything. What are your opinions of people who are smoking? Who are doing all kinds of stuff? Does smoking have a very bad impact on your oral health?
yes, even
Let's talk
smoking.
about it. It's a very people are smoking nowadays, and their oral health has been decreasing. So your thoughts?
Yes, pan, gutka, smoking, everything affects oral cavity,
Mm-hmm.
and ultimately leads to removal. I mean, exfoliation of your tooth
Mhm.
by reducing the efficiency of the gingiva. So gingiva is the thing which will protect the tooth or catch the tooth in a position. So if the gingiva gets loose,
Okay.
ultimately tooth is exfoliated. So that
So I heard that there are some very extreme cases where they developed an oral cancer and where the whole jaw has to be removed, or
yes, that
make
is
some changes to your
yeah.
head. So
that is
let's talk.
severely that is severe stage of cancer, which is
Okay.
called metastasis.
Mm-hmm.
So on that stage, the whole oral cavity, oral mucosa, and the tongue, as well as the tongue is affected.
Mm-hmm.
So the overgrowth of the tissue is seen, and ultimately it leads to multiplication of the cells, and we have to remove it. There is no other I mean
No other
no
alternative
other
for.
alternative for this. We have to remove it,
Mhm.
and that's a very bad situation.
So let's talk about oral cancer. Do you think like smoking or having a pan masala on a daily basis would and make you a potential to have a oral cancer?
Yes, I say only gutka,
Mm-hmm.
which will cause oral cancer, and smoking. As of now, the studies have been only 5%
Okay.
as an oral cancer,
Okay.
and gutka may have more than 50 to 60% having an oral cancer.
Mm-hmm. So what do you suggest, like for these people who are doing such things, to take measures to reduce their risk of getting that oral
Yes,
cancer?
this is nothing but an addiction.
Yeah.
So addiction can be cured by many stages and many situations.
Mm-hmm.
So addiction
Yeah.
can be done due to decreasing of daily basis how much cigarettes you smoke.
Mm-hmm.
Like if you smoke 5 cigarettes in a day, reduce to 3 or 4. So let's go on to 2 to 3 months, and eventually you end up with 2 cigarettes a day
Okay.
or one pan masala a day. So cope up with your
Addiction and try to get
try
over
to
it.
get.
So eventually, all these things are leading to or might be leading to a cancer or an infection as such. So if you guys have any other questions, we would love to answer it. Uh, I see a lot of questions popping up on your live chat.
Yes.
Actually, Ravinder has to say hi to all his friends.
Yeah.
They're
Yeah.
really
Yes,
working
yes.
hard.
Subhakar, Hemant,
Yes, hi Subhakar, Abhishek,
Just say hi to
Flamino,
Akhil,
Akhil Reddy.
Akhil Reddy.
Akhil Bhaskar Vatla.
Yes, Shreyas. Hello, bro. Hi.
I'm addicted to water, please.
I'm addicted to water, please. I guess water is good for your health.
Hey, there's
I
some,
guess water is good for your health. You can drink however you can.
hey dog, there's some
So,
good.
so there's a question here which says,
Hi,
what
Akhil.
are dental emergencies? Like, when do we call it? It's an emergency.
When you have a severe pain
Okay.
or swelling
Mm-hmm.
on your side of your face, or severe pain which when you experience while you sleep,
Okay.
or when you chew anything hard on your teeth, it's called
Yeah.
an emergency.
So, like, you can't bear that pain. You
Yes,
just
you
need to
can't-
go for a
you
dental
can- yeah,
emergency.
you just can't bear the pain. You just call the doctor, make an
Mhm.
appointment, and do the treatment as soon as possible before it's get too late.
Yeah. So, as we come to the end of the talk show, what are your suggestions on oral hygiene, oral health? What do you think people should be doing right now in order to stay healthy? So, your thoughts about it, and moreover, people are using mask on their faces and covering. So, your thoughts on it?
So oral hygiene is must for everyone.
Yep.
You should brush twice daily.
Mm-hmm.
So immune response matters in the dentistry as well. So if you develop an immune system, you are not prone to many diseases, or which causes example for this coronavirus.
Mm-hmm.
So I want to talk about this virus.
Sure.
So immunity is a crucial part in this.
So, I guess everything comes down to
Yes.
your immunity. How
Yes.
strong are you
How strong
innerly?
are you? How immune are you?
Mm-hmm.
Vaccines are nothing but developing an immunity within you.
Yeah.
So immunity is the best possible way to eliminate any virus and even bacteria.
Yeah.
So my thoughts will be morning taken hot water
Mm-hmm.
with honey as well as a turmeric powder
Mm-hmm.
every day before breakfast. You should drink daily. So this will cope up with your immunity.
Okay.
So you will be healthy and prone to.
So I guess that's it for today, and I hope this information which he has shared will help you out in some or the other way, and I hope you have maintain a really good oral hygiene, in this situation, and where dentists are not available for you to go and meet or get treated at the moment. It is important for you to have a nice oral health, not now especially, but entire life, where you need to have a good oral health, because it's related to all your diseases or everything in your body, so it's interconnected with everything. So make sure you have a nice oral health hygiene and a oral routine, where you do it every day in order to have a really good health. So I just want to quickly thank Ravinder
Thank you.
for coming on my talk show and
Yes.
having a good time with us and with the audience who's watching now. And I hope he is able to clear your doubts,
Yes.
and it's gonna add value in your life as well. So thank you so much for tuning in, guys. I hope you have an amazing evening today
Yes,
and an
if you-
amazing week as well. If you have any
If you have any
queries,
queries or suggestions, DM me or DM Sachin.
sure.
I will be available.
He'll be happy to talk
Yeah,
to
we
you, get your problems corrected, or get your queries suggested, everything. So thank you so much for tuning in, for all the people who are watching me live and live on his page as well. Thank you so much, guys. I hope you have an amazing day. Thank you so much.
Bye, guys.
Bye.